My name is Samantha Sharp, and this is my final video assessment for Nursing 3200. Here is my Dixie State ID. My project is on congestive heart failure. Hi, sir. What brings you in today?
Hi, I'm a 61-year-old Caucasian male. My chief complaints are trouble breathing, especially while lying down, chest pain frequently, lack of appetite, weight gain, swelling in my legs, especially around my ankles, and increased urination at night.
Okay. Based on your symptoms and chief complaints, the three systems I will be assessing are your cardiovascular system, respiratory system, and peripheral vascular systems. So we'll start with your cardiovascular system. Go ahead and take your shirt off and lie down on your back. I'm going to come and feel your carotid and your jugular pulses. Pulses alternans are present. I'm going to percuss for cardiac dullness over the fifth intercostal space. It is dull over the heart, which is what we want to hear. Now I'm going to auscultate over your heart. There is diminished S1 sounds and no other extra sounds. Now I'm going to locate your PMI, or point of maximal impulse, which is fifth intercostal space and mid-clavicular, just about here. Perfect. Okay, now I'm going to assess your respiratory system. Go ahead and sit up for me. Assessing the shape and the size of your chest. Normal adult chest shape. And as you're breathing, there are no retractions or accessory muscle use. I'm going to take a listen to your lungs here in the front. Take a deep breath for me. Good. Big deep breath. Big deep breath. Now listen under your arm here. Big deep breath for me. And again. And then on this side, big deep breath. And again. Okay, I'm going to have you turn towards this way. Listen to your lungs on this side. Deep breath. Great job. There are some crackles that are noted in the bases of both sides of your lungs. I'm going to auscultate over your trachea. Good. No adventitious sounds are heard. Now I'm going to assess your peripheral vascular system. Go ahead and lie back down on your back for me. Perfect. Checking the skin, color and condition on arms, and on legs. Color is normal for ethnicity and skin is in good condition. Now checking for capillary refill. On the fingers. Four seconds capillary refill on both toes and fingers. Feeling for edema. +1 edema on lower extremities. +2 edema on foot and ankles. Okay, I'm going to check your pulses. I'm going to start with your brachial pulse. Normally I would check for 30 seconds or more, but for this video's sake, I'll do only a few seconds. Your radial pulse. And your brachial pulse again. And your radial pulse. Go ahead and relax. Now your femoral pulse. Popliteal pulse. Go ahead and bend this leg for me. Good. Bend this leg for me. Good. Post-tibial pulse. And dorsal pedis pulse. So the brachial, radial, femoral, and popliteal are all +2 pulses. The post-tibial and the dorsal pedis pulses bilaterally are +1 pulses. Definitely more fainter the more peripheral you go from the heart. That concludes my 3-system assessment. You can go ahead and sit up, sir. Based on my findings, I think the diagnosis would suggest congestive heart failure. Thank you for your cooperation, and that ends my assessment.